Now back to one of the stories that we're following closely today, where the Health Minister, Dr. Zweli Mkhize, and the Gauteng Health MEC, Dr. Bandile Masuku, were visiting the Tshwane District Hospital in Pretoria to monitor their preparedness as the province becomes the COVID-19 epicenter. Our reporter Linda Mnisi is there and joins us live. A very good afternoon to you, Linda. Quite a lot that seemed to be covered today as far as preparedness for the province is concerned. Some highlights from you.
Well, a very good afternoon to you, Tammy. The Minister there and the MEC highlighting some of the measures that have been taken to make sure that the province readies itself for the surge. The Minister there speaks about the shortage of employees and medical staff and says that they've already started looking at ways to, make sure that there's enough capacity in terms of human resources in these hospitals. He also speaks about the issue of making sure that there is enough oxygen and ventilators, saying that at Nasrec they're already looking to put up oxygen points, 1,000 oxygen points, that is. Speaking also on a number of issues that are really, a hindrance to the work that is already being done. You'll remember the issue around alcohol. The Minister there saying that they've really been receiving a number of complaints regarding how the number of alcohol-related incidents have continued to burden the health system. He says they're in conversations with the National Command Council in terms of what to do and what steps to take next.
There was also a bit of controversy around the digging of graves in Gauteng. How did the Minister address that?
Well, you'll remember that just 2 days ago there was indeed the issue around graves, and a lot of people thinking that there are in fact 1.5 graves that are currently being dug. Well, the Minister says that was a misunderstanding, but rather this was issues around capacity. He says that one thing that they're focusing on is making sure that they increase capacity to respond to COVID-19 cases, and that their focus is not really on burying people, but also on saving lives. So the issue around those 1.5 million graves is that what they're basically saying is that they have capacity, not that they are digging 1.5 million graves.
I'm sure that comes as a sigh of relief for many who are starting to get concerned that graves are being dug, 1 million graves. That is quite a startling number. But Linda, he also spoke about the issue of modelers, saying that the rates are increasing in the country, but not at the rate that they had actually anticipated.
Indeed, Tammy, he mentions that, the numbers are increasing as expected, but not at the rate at which they are increasing. He says he attributes this to a number of interventions, including the relaxation of some of those regulations, saying, of course, with the number of people moving around, the surge will, of course, hit various provinces. He does, in fact, say that a number of provinces will experience what the Western Cape has experienced and what the Gauteng province is currently experiencing, that in the next coming months there will be that peak. The eye of the storm is here, and that a lot of people should now start taking it seriously, because it has become more important, more than when we started the first lockdown.
I did, upon the conclusion of that particular briefing, wrap up the issue of the motorcycles that have been procured in the Eastern Cape. But if you could just give some clarity and light on that. I mean, it's still very hot, it's still very topical. Various opposition parties, the DA also coming up and saying that those motorcycles are not fit to be used as ambulances. But the Premier, the Minister, cleared that up as well today.
Well, Tammy, the Minister did not really give a definitive answer in terms of how and at what point did he realize that they did not meet the criteria. He basically says that, in fact, he will not be discouraging people from trying. He also indicates that this was a measure and an intervention to help those who are in outlying areas in the Eastern Cape, but also the fact that this was in fact not ambulances, but also scooters. But the question, you'll remember, Tammy, was not necessarily on whether these were ambulances, but on whether this meet the basic requirements for patient transportation. But the minister, they're not giving us a clear answer, but saying that he was told there was no need for him to be consulted, but he was told about these scooters, and that he encourages that the results will be in when they are actually being tried.
All right, well, we'll leave it at that for this afternoon, Linda. Thank you so much. That's our Linda Mnisi, who's been covering the walkabout by the Minister of Health today in the city of Tshwane.